My name is Jacob, and this is going to be my subcutaneous and intradermal video. So the first thing we do is I have an order for medication. I know my order, the original order. I'm going to check that against my MAR, make sure everything's compatible, and then I'm going to know what medication I'm going to be administering. I need to know special considerations, special nursing considerations I need to do. I need to check my MAR, make sure that the allergies with the medications. I need to make sure that when I'm calculating the medications from my MAR, that they're in the safe dose range. I need to know any adverse effects of these medications with my patient, and make sure they're appropriate for my patient, making sure that they're the right drug. So then once I do that, I'm going to grab my MAR, and I'm going to go to my nursing cart, open it up, and the first check is when I get the medication out. So the first thing I'm going to do is my intradermal. I have my medication for my intradermal. That's my first check. And my second medication I need is subcutaneous from an ampule. So I have those. So that's my first check. I'm going to perform hand hygiene before I start administering these. And then when I'm doing my second check, I'm going to grab my my intradermal syringe right there, my TB syringe. So I'm going to open that up. Like that. And then what I would do is I would take my alcohol prep, sterilize the top of my med, and then I would withdraw this set amount, which is 0.25, so you don't want to go over half a milliliter for an intradermal. So I have that, so then I would uncap it, stick it, push the air in, invert it, and then withdraw the medication. But because of this, I need to have air to withdraw it in the specialized pad. So I'm just going to make sure I have 0.25 mils of air in there. I will cap that, and make sure that that was the appropriate medication doing my second check that I needed to be administering. So that matches up. I have the right amount, the right medication, and it matches up. So that's good. I'll set that aside. The next one I need to do is subcutaneous from an ampule. So I'll get my supplies ready. I need to have 1 milliliter. So I'm going to use my 3 milliliter syringe. I also need a filter needle because I'm doing this with the ampule. So I have my filter needle. Put that on. Next, I need to open up my ampule very carefully. Take a piece of gauze. Take my gauze. And then very carefully, we're going to break this away from you. Alright, so just a little snap. There we go. And then I would immediately throw this in the sharps container. And once I have that out, I'm ready. Put that in the sharps container as well because there might be glass in there. I would then be very cautious not to touch the outer edge of this when withdrawing from my filter needle. So I'm going to carefully insert. Okay, I am just going to hold it there and stabilize it. And then I'm going to withdraw, but you do not aspirate this. So I'm going to withdraw practically all of that, and then making sure there's no air bubbles. There's a big one in there. There we go. So then, there you go. Just push that up, make sure there's no air bubbles out, and the appropriate medication. There we go. So I have that. I need to take my filter needle off. So I'm going to scoop that up, cap that. I'm going to remove this and put this along with the rest of my ampule in the sharps container. So that goes in the sharps in my med cart. I'm going to save this, however, for later, but that goes into the sharps. So then I prepared my medication. I'll be doing my second check. Have the right amount, have the right amount of medication, have the right medication. And then my third check is putting away the medication. So the ampule is in the sharps glass. I'm going to check, make sure I have this one, and that's going to be going away and putting that away, and that'll be my third check. And then I need to, I'm going to be using for my subcutaneous, I have selected a 26 gauge, 3/8 inch. So I'm just going to apply that. Okay. So now I have all my medication ready. I have my MAR. And now I'm ready to go to my patient. So I'm going to walk over to my patient's room and going to knock on the door. And I'm going to introduce myself as a student nurse. I also need to identify my patient. So I have my medication. I'm never going to turn my back on that. I'm going to do some hand hygiene. Obviously providing for privacy in case there's someone else in the room. So I need to identify my patient. Can you state your full name and your date of birth? Okay, and I also want to check his wristband. There's his wristband. Next, I want to tell him about the procedure that I need to do. So I need to administer a subcutaneous injection as well as the intradermal. So I want to make sure I'm at a good working height for myself. Making sure that, what is this? There we go, this thing's down. So I have medication there. And I want to tell him all about the effects of the drug, what to expect, and the reason why he needs this drug, and make sure that he's compliant. And if he is, I will go ahead and administer the drug. So the first thing I'm going to do, along with finding the site, I want to make sure that he knows all about the drug and with the 5 rights. So that's the right time, and my MAR is the right time, right route. This one's going to be an intradermal. Right medication, I have done that, and the right patient and time, and we're good. So then I need to do some site finding. So the first thing I'm going to do is I'm going to find the anterior portion of the arm. You see that? Mm-hmm. Okay. So I'm going to do 4 fingers from the elbow joint and 4 fingers there, and I'm going to find right in the anterior portion, right about there. And for the purpose of this video, I need a specialized pad. So I would generally place this over there, but for better positioning, I'll demonstrate that. So then I have my intradermal. I'm going to put on some gloves. After I've found the appropriate site, I need to clean the site. So I will use my alcohol wipe. Don't know if I'm supposed to use it on it, so I would start with the center and work my way outward in a circle. So once I did that, and I have the right site, we'll then administer the drug. Take that off. Now making sure the bevel is up, I will insert the needle very, very carefully, about 5 to 15 degrees. Insert it just so the needle goes underneath the skin, and then slowly apply and hopefully get a wheel, but this stuff doesn't do that. There we go. And then carefully withdraw the needle. Done. And then this goes in the sharps container immediately. I need to save this for later. So do that. And then I would use a piece of gauze just to wipe up any excess any kind of medication that comes through. So just gently wipe that up, just not really touching it because there should be a wheel formed from that. So I'm going to discard this along with all this other stuff. Put that in the trash. My next injection is going to be a subcutaneous injection. So with that, I'm going to do the side of the abdomen. So I'm going to be providing for privacy. I know my patient has an abdominal wound, so I'm going to be going off side of that. So what I would like to do is, I can show you on this side, is that I want to go above the belt line and then 2 inches from the umbilicus, right on the side. So probably about right there, right on the side of the abdomen. So I'm going to do that on my pad right here. Provide for privacy for my patient. So with that, I have my medication. Once again, I need to clean that. Do that. Start from the center and then working ways in the circle outward. Do that. I will then take the needle. And now this, you want to go to a 45 to 90 degree. I'm going to pinch, and then with a dart-like motion, insert, release, stabilize, and then slowly inject the medication in there, and then take it within the same motion you did. And this would go immediately into the sharps container. But I'm going to save that for later. And then we'll take another gauze just to see if there's any excess medication comes out, and just kind of just dab that up like that and throw that away. And then I will assess my patient, making sure that they that they have, that they feel okay about that medication. Take my gloves off, hand hygiene, throw those away, and then I would document on my MAR exactly the time and the appropriate medication on the MAR, and initial it, and then I would make sure my patient is okay. I would also come back in a little while to make sure that the effects of the medication has taken effect and there's no adverse effects and they're feeling comfortable, and then I would make sure that they are okay. I would also assess and see if they need anything else, whether toileting or whatnot. I would also raise the side rail and lower the bed of the possible patient, see if there's any other thing that I can do for them, make sure that they're call light, just in case they need me for later, and then I would also document everything in my nurse's notes and make sure everything is good. And that's my video.